So just thank you everyone for joining today's session. We're joined today by two members, Noah and Sophie from who serve on two of the CalHOPE programs that deliver private virtual behavioral health coaching and resources for youth ages 0 to 25. And they will be talking more about Brightlife Kids and Soluna. We thought it was really important, given that this new service or both of these programs began this year. And given the scope of the Elevate Youth California program and working with young people between the ages of 12 to 26, we thought it was really great to be able to, for you all to hear about these resources if you already haven't, in case that you needed to make referrals for young people that you work with, as well as I believe Noah and Sophie will talk about some opportunities as well, in which if your organization wants to serve to help provide some services as well. So I'm going to go ahead and pass it over. No, I believe I'm passing it over to you first to share, and we'll share the slides as well. And again, this session will be recorded, and we'll share it back with you all.
Fantastic. Thanks so much, Palvinder. Thank you to the team for giving us the space today to chat. My name is Noah Oldak-Moradian. I am the Senior Manager for Community Engagement at Brightline for the Brightlife Kids program. And I oversee our feet on the street efforts to get the word out about Brightlife Kids. And I'm super fortunate to be joined today by my colleague, Sophie. So I'm going to hand it over to Sophie to briefly introduce herself, and then we'll get started.
Hi, everyone. My name is Sophie Weisbord. I am the California Customer Success Team Lead here at CalHOPE, which is the company behind Soluna. I am located in the San Francisco Bay Area. And yeah, I'm excited to share more about both Brightlife Kids and Soluna today with you all. Thanks for having us.
Awesome. Thank you, Sophie. So I think we can move to the next slide. Both Brightlife Kids and Soluna are really here today to talk about resources and access to behavioral health virtual services. So for our time together, we're going to spend just a beat talking about barriers to accessing care that you all are receiving. We'll go into how both of our sister programs were founded, and then dive a little bit deeper into each service and what it really entails, and how it's built to be geared toward these different age groups. And then at the end, we'll talk about opportunities to partner, which we're very hopeful that all of you will want to chat with us after today, and we'll leave time at the end for Q&A. So the only thing I will add here is while I'm speaking, if any folks have questions that they want to drop in the chat, you can absolutely do that. Sophie and I will take turns monitoring, but there will be also time at the end for you to share any questions that you have. So with that, let's move on to the next slide. So because there are, counting now, 84 amazing participants in this virtual room, we wanted to hear from you all about some of the challenges to accessing mental behavioral health resources in your communities. Feel free to just briefly put something in the chat. We'll take about 30 seconds just to hear from you all. Insurance, immediate answer. Yep, that's a big one. Shortage of providers. Thank you. Money, wait lists, transportation access. I see stigma, more transportation. Yes, absolutely. These are things that we hear a lot. Language barriers, transportation cost, finding a culturally competent therapist, very big. Undocumented, yep, location, access, lack of awareness. These are all fantastic, definitely patterns that we've heard before. Let's see here, funds, personnel, yep. The limited menu of services, the flexibility of the service. Okay, fantastic. Thank you for sharing. I love that, and feel free to keep them coming. I love that, we are seeing a lot of the same sort of challenges and obstacles that we've heard in a lot of other spaces. I'm sure that Sophie will agree. And what I love about both of our programs is that they address a lot of these points. So yes, the continued stigma around behavioral health services is huge across different communities. All right. Well, keep them coming. We're definitely taking a look and keeping an eye on those. With that, why don't we go ahead and jump to the next slide so that we can, share some more. So first off, to sort of center us on how both of these programs came to be, Brightline and Kooth were both selected from hundreds of vendors as the behavioral health virtual services providers, BHVS, under the Children and Youth Behavioral Health Initiative, CYBHI. So I always joke that we are swimming in acronyms, so no need to memorize those, but basically what you really need to know is that we are both funded by the Department of Healthcare Services, the state of California, which allows us to be completely free to our users, our families, our youth, and the kids. So Brightline and Soluna together, we live under this CalHOPE umbrella. Next slide, please. All right, so when you think about our programs and the distinction, perhaps the most important piece are the age groups and age brackets that our programs are geared towards. So Brightlife Kids is really geared towards families with children ages 0 to 12, while Soluna primarily provides services for those ages 13 to 25. So what I will say is that these programs have a lot in common, probably more than what distinguishes them. We both launched on January 1st. We emphasize both live and asynchronous support. We have multilingual support. We provide digital tools that can be leveraged by users if you don't want to do live support. And perhaps most importantly is that we were both designed with our central users and their voices in mind, right? So you can't go wrong with either offering. We both work really, really closely together. And just again, to emphasize, Brightlife Kids is a program of Brightline, and Soluna is a program under Kooth. And with that, we will dive a little bit deeper into what Brightlife Kids specifically offers. So next slide, please. All right, so just want to talk really briefly about our company, Brightline. We were founded in 2019 in Palo Alto, really to address the pediatric behavioral health crisis and to make support for families more accessible nationwide. So really since then, we've been at the forefront providing mental health support for kids, youth, and families. And that was primarily through health insurance contracts and employer plans, which allowed us to access more than 60 million folks and provide them with services. Next slide, please. Yeah. Today, we're here to chat more about Brightlife Kids, the program that is funded by DHCS and the state of California. And Brightlife Kids was really intentionally designed to be accessible to all California families, regardless of income, insurance status, immigration status. These are all things that you all mentioned in the chat. There is no cost, there's no cost involved, and there are no insurance or referrals required. So we do not ask about these details when folks decide to opt into Brightlife Kids. The program is available virtually through phone, tablet, or computer. So families can navigate to brightlife.kids/CA, and we'll reshare this at the end of the presentation, or you can download our app, Brightline Mental Health, on Apple or Android. And when you register, all you need is an email and a zip code in the state of California to validate your eligibility for the program. So on the slide, you can see some of the, really a wide range of issues that our behavioral health experts can assist with. So whether those are developmental milestones, emotional well-being, school stress. I, for example, have a toddler with very, very large emotions, and I always am looking for support, figuring out how to navigate everything that comes with having a relentless and small but fearless child in my home. So those are one of the ways that Brightlife Kids coaches can really support. Another piece I really want to emphasize here is that we proudly offer fully bilingual services in English, Spanish, and then we have live interpretation services for 17 additional languages. So some of those being Russian, Tagalog, Arabic. And in fact, if someone needs help navigating, they can actually call our member services line and request support in any of the listed languages, in addition to live translation during services. All right, so exploring a little bit about how Brightlife Kids integrates into existing delivery care models. I'm sure many of you are familiar with, the sort of breadth and depth of options in your communities. So at the top here, we have licensed therapists and physicians, and they really manage those specific presenting concerns and symptoms, primarily focusing on higher acuity needs. And then below in yellow is where the majority of kids and families are positioned, and it's where Brightlife Kids places its focus, and that's on prevention and early intervention. So our aim is really to support families in prevention and wellness before they require diagnosis and clinical intervention, really reducing the likelihood of progression to clinical care or emergency services. With that said, of course, we will talk about how we support any higher acuity needs that walk through our virtual doors, but we know that the earlier the intervention, the better the outcome. And our collective goal is really to normalize conversations around emotional health and working together to build a more robust foundation for children and their families. All righty. So Brightlife Kids provides personalized assistance for families navigating these really diverse stages of child development, recognizing that 0 to 12 is quite a wide age range of developmental stages. So from around ages 0 to 6, we really focus on our parent training management program. So different ways to establish effective routines, to navigate challenges with big emotions and tantrums. And then for children ages 6 to 12, our coaches will determine if the child is developmentally ready for one-on-one sessions and or consider a combination of sessions where both parents and caregivers and their children are present. All of which is to say, we get a lot of questions about, is it for the child? Is it for the parents? And it's really for the family. So there's a lot of flexibility for families to determine with their coaches what combinations of sessions they would like to pursue that are best to address the issues that a particular family is facing. And then the other thing I'll just emphasize here, through that entire time, you'll have access to our digital tools, and we'll talk a little bit more about what that looks like. So another piece that I really want to emphasize is that we often get questions like, if these are not therapists, what are the coach qualifications? So our coaches hold either a master's degree in a health-related field, or they have a bachelor's degree in combination with a certification from one of these nationally certified accreditation boards. And we ask that they have at least 5 years of direct experience working with families, but our team actually averages 7 years across the team, working in environments like schools, community practices, pediatric care. And then once they join Brightline, they undergo an additional 80 hours of training before they even see families. And that includes training to promote culturally inclusive care for LGBTQ+ and BIPOC communities. So there's a lot of ongoing and training support throughout, their time at Brightlife Kids. All right. So what does the experience, the user experience look like? So here you can see some snapshots. As I mentioned before, a family comes in, they put their email and their zip code, as well as the age of their child. And then based on that age, they're going to get a different assessment. The assessment takes about 90 seconds to complete. It is not a grant application or anything, scary like that. And once they submit that assessment, they will actually get their results fed back to them. And the results will indicate if they are a good fit for coaching or if they need a little bit closer care with specialized coaching. So specialized coaching is if a higher acuity need was identified. And we know that in addition to our in-house coaching, we're going to have to refer a family out or identify services that are outside the scope of coaching. So it's a really, really great resource for our families. And again, I will emphasize that throughout this, once the assessments are complete, you will also have access to those digital tools. So next slide, please. Speaking of digital tools, I think what's really, really great about programs like both Brightlife Kids and Soluna is we really meet families and youth where they are at. So when I think about Brightlife Kids, I think about three primary buckets. So our digital tools, once a family creates an account and they have those assessment questions, the content that they see, so the articles, the podcasts, the exercises, will all be tailored to them based on the age of the child. And they can access those digital tools regardless of whether or not they book a session. If they never think about coaching again, they can always sign in and have an option, to leverage those tools. And then, of course, we have what I like to think of as the bread and butter of our offering, which is our behavioral health coaching. So we have two ways of accessing our coaches. One are those live one-on-one sessions. So you can take a look at coach profiles based on the languages they speak and their background, see what's the best fit for your family. And then you can also leverage our secure chat tool. So if, a session is a couple weeks out, but there might be, a burning question or something a family really needs answering, you can go ahead and chat a coach live and then they can get back to you. Our standard business hours are 9 a.m. to 8 p.m. Pacific Standard Time. So there's quite some time to, get a hold of someone who can support and help. And then lastly is our care coordinations piece. So I talked a little bit about specialized coaches and how they send referrals out. So these referrals can incorporate anything from, therapy to support on those higher acuity needs, to maybe someone needs to know their local food pantry or where to get baby diapers, right? Really depends on what is going on in that scenario. And as part of care coordination, both Brightlife Kids and Soluna are developing something we called an affiliate network, which is basically a cohort of trusted partnerships who we have had conversations with, who have high rates of availability to take referrals and are in high communication with us about our members. So another great opportunity, if this sounds like a match for you, at the end, we'll drop our contact information. Next slide. All right, and now we have a short video just to sort of summarize everything that I've discussed today, and I'll use that time to take a look at the chat. I think there's no audio, Sophie, because you're muted.
Sorry about that. Okay, let's try that one more time.
But what if you had a coach by your side? Brightlife Kids by Brightline offers behavioral health coaching and tools for parents and kids ages 0 to 12. It's high quality care with no cost attached and no insurance needed, paid for by the state of California. When you join, it's important for us to get to know you and your child and understand any concerns you have, such as stress, worries, bullying, transitions, and more. We look out for any safety needs we should address quickly. And what you tell us will always be kept private. We then use assessments to get a snapshot of your child's behavioral health, and we show you the results right away. This helps us form a customized set of options to meet your family's needs. We offer digital tools like parenting videos and exercises, where your child can learn skills like how to manage their feelings, care guidance on local and crisis resources, and live video sessions and secure chat with a dedicated coach. If you want a live session, just choose a coach that best fit your child and book right away. Our coaches have master's or bachelor's degrees with coaching certificates and at least 5 years of experience working with kids and families. We have bilingual English and Spanish coaches and interpretation available in 18 languages. You can also chat with your coach if you're on the go. Whether it's through the library or resources or your dedicated coach, we can help you navigate your child's developmental milestones and challenging behavior. Now, if your family needs more support, we'll provide a care guide who can help you decide on care options and get set up with in-person care or other supportive services right in your community. Let us support your family to build tools, get coached, chat, find local resources, and more. Go to brightlife.kids to get started.
Awesome. Thank you, Sophie. So with that, I'm actually going to hand it over to Sophie to talk a little bit more about Soluna and CalHOPE.
Thank you, Noah. Awesome. All right. Well, like I said, my name's Sophie. I am the California Customer Success Team Lead at CalHOPE. CalHOPE is the name of the company. Soluna is the name of the app. These things get a bit confusing. Brightline, Brightlife, CalHOPE, Soluna, but happy to reiterate at any point. But yeah, really excited to chat with you guys today about Soluna. As you just heard, Brightlife Kids is the app for 0 to 12 and their caregivers. Soluna is the app for 13 to 25-year-olds. A little bit about CalHOPE, the company behind Soluna. We were actually founded over 20 years ago in the UK, and since then have provided almost 11 million youth with age 10 to 25 access to mental wellness resources. So we've got a really fantastic history and have been excited to bring that success over to the US. We place a really high emphasis on user research and feedback, similar to Brightlife Kids. So the design of the Soluna app is truly based on that user research and feedback. It's based on the needs of young people for a free, safe, and accessible space for support. So I'll point out as I go into the app a couple of the fun ways in which we really incorporated that user feedback and that user voice. We really believe in the power of equipping young people with evidence-based tools to support themselves. So you'll see a lot of that today as well. And yeah, with that mission in mind, I present to you Soluna. This is sort of a sneak peek into the youth's experience in the app. So earlier I mentioned how valued user and feedback is. So I do want to emphasize that everything from like the constellation theme that hopefully you can see here, to the color scheme, to the types of content that we have, the categories of support that we offer, this is all a result of that user feedback. So us going out and talking to 13 to 25-year-olds who live in the state of California. Our support structure is designed really to encourage our youth to build essential social emotional skills that prepare them to really effectively navigate their day-to-day life rather than focusing on repairing. So I like to think of it as like, focusing on preparing for your day rather than repairing your day, right? So building out those essential skills, building out that wellness toolbox so that folks have that foundation of well-being in order to, approach their days with a bit more ease. So we have sort of 3 different categories of support here, starting with this first level. Soluna offers self-guided resources and universal support. So this level really focuses on fundamental practices, so such as healthy habits, goal setting, personal reflection through journaling to serve as, again, that sort of foundation for well-being. The example highlighted here is our thought shaker, I believe. Yes, which engages the user in positive affirmations and sets the stage for really normalizing positive self-talk. In the second level here under community support, users will have access to explore additional content and engage with peer community support. So this includes various activities, discussion boards are, I would say, the most popular feature here, as well as helpful articles from our content team and our users. One thing that I would say one of the biggest things that we learned from our user research is that young people really feel most comfortable contributing anonymously. So when asking them what would entice them, what would bring them to an app like this, what would make them feel most safe and comfortable contributing, the biggest thing that we heard was anonymity and confidentiality. So with our users being completely anonymous, we of course want to prioritize safety in everything that we're doing, which is why our app is actually pre-moderated. So what that means is that we have a vigilant team of human moderators on the back end of our app. And essentially, anytime a user wants to post or respond to anything within the discussion boards in our app, that post is first sent to our backend where it is reviewed by a moderator to ensure it is safe, kind, appropriate. Should it meet those standards, then it gets posted. Should it not, then it doesn't get posted, and the moderator will let the user know the reason for it. So that, again, is sort of how we maintain that safe space. So unlike, social media or other places online, anything that gets posted to Soluna is going to meet those criteria. finally, in the third level, we introduce our behavioral health coaching with our coaching features. So our behavioral health coaches provide sessions and guidance really tailored to individuals seeking that one-to-one support through either dropped-in or booked coaching. So we have the option for drop-in coaching currently. Both of our coaching types are available from 10 a.m. to 10 p.m. And our did I get that right? Yes, 10 a.m. to 10 p.m. And our drop-in coaching right now has an average wait time of, I think, up to 10 minutes, so pretty quick. And our booked coaching is also available 365 days out of the year, with, I believe, a wait time of you can book within 48 hours. So we've maintained a pretty good response time and schedule there. The last piece that I'm excited to share about within this third level of support is our searchable repository and care navigation. So we have a searchable repository for users to explore on their own, to dive into additional resources outside of the app, should they want to, should they choose to. We also recently came out with care navigation and full care coordination. So essentially, users will now also have access to care coordinators. The idea behind this being that we will not just source the resources for the user. So let's say a user has a need outside of what the app is able to offer. For example, say a user is experiencing food insecurity or housing insecurity, they can get connected to a care coordinator who will help them take that next level of care with A, questions to understand their need, and then B, offering that warm handoff as well as a follow-up. So providing what we call closed loop care to ensure that the resource met their needs, that they were able to make the appointment, and that there isn't anything further that they need. And should they, then they continue that conversation from there. So very excited about CareNav and care coordination being recently launched, as I know this is something I could still benefit from to this day, support in finding those additional resources. All right, so just to kind of highlight again some of our safety features, as it is really a core component of everything that we do, from our pre-moderation, which allows for risk identification and intervention, to our anonymous service model, which fosters that safe and secure environment for users to be themselves. We focus on that safety of our users in every interaction of our app. We also adhere to all local, state, and federal guidelines in our reporting and regulations. So ultimately, our safety measures really are able to both provide the autonomy and empowerment of our users, and our model allows them to be in control of their well-being. This I won't touch on too much, as I know Noah did a wonderful job of sort of highlighting this pyramid here, as we're quite similar in this way. But Soluna and as well as Brightlife Kids, really operate in that subclinical space. So our subclinical model really emphasizes prevention and early intervention, so fostering that supportive digital environment. CalHOPE chooses to focus on what I kind of think of as like the massive missing middle, right? So the vast majority of young people who maybe don't have a mental health diagnosis or are not facing an immediate crisis, but are struggling with preclinical, emotional, social, and mental health challenges, right? And are creating a demand on the clinical system. We are here to support them. We are here to help them build that foundation so they can also have the autonomy to support themselves. And we're here to provide that warm handoff and resources should they need that, extra layer of clinical support. All right, so as you saw on our last slide, our services are subclinical and preventative in nature. In the case that Soluna is not the solution for the users, we, like I said, are there to provide that bridge to connect them with the right support that might meet their need. I know Noah had mentioned our affiliate network. We sort of think about this similarly. When we think about the purpose of our affiliate network, we really see community organizations, schools, medical providers referring young people to the app for that support, again, to augment the support they're already receiving maybe from those programs and providers. So we want to highlight that it's not a replacement for any existing services or supports, but rather augments existing supports, right? So building those sort of bridges to each other so that all young people have access to the resources that they need. Okay, here I'm gonna play a little video for y'all now, and hopefully the audio works.
I'm Stacy.
Here you go.
Today I'm going to walk you through Soluna, a brand new CalHOPE program powered by CUTH. I've just downloaded the native iOS app from the App Store, and I'm registering for an account both quickly and hassle-free. When you first open the app, you have the opportunity to select the language of your choice. As of right now, our options are English and Spanish, but we'll include more in the future. To sign up, Hi there, I'm Stacy, and today I'm going to walk you through Soluna, a brand new CalHOPE program powered by CUTH. I've just downloaded the native iOS app from the App Store, and I'm registering for an account both quickly and hassle-free. When you first open the app, you have the opportunity to select the language of your choice. As of right now, our options are English and Spanish, but we'll include more in the future. To sign up, verify your age and zip code. After this has been completed, one has the option to either continue as a registered user or as a guest. To become a registered user, you can either continue with your Google or Apple ID or through email. If a user feels uncomfortable sharing this information, they can continue as a guest. As the guest option indicates, you don't need a registered account to use Soluna. However, sign up is required to access coaching and community features. Here, you see the default view of the Soluna app. This is what we refer to as My Sky, a constellation of support resources for a wide range of common issues. Users can explore their sky by scrolling through the different constellations. Like here, we have body acceptance, strengthening relationships, or leaning into values. Each constellation has many different stars, featuring an interactive resource for self-guided support. Soluna is also home to a variety of different tools. Users can track their mood through our intuitive mood log feature, or explore other therapeutic tools such as the Starboard, Thought Shaker, or Breathwork. Peer support is another key aspect for Soluna. Users can connect with their peers in a safe, moderated environment to learn and share their experiences with others in similar situations as them. One of the best features of Soluna is the access to one-on-one coaching. Here, I have two choices. Schedule a session with a Soluna coach whenever works best, or simply drop into a session right away. There's no cost or insurance needed from the user, and the user information stays completely confidential. Soluna prides itself on creating a safe environment. That's why the moderation team prevents potentially harmful posts. Professional support may also reach out to users when appropriate. Soluna also provides access to additional resources along with emergency service information for those who may find themselves in need.
All right. So hopefully that gave you a nice overview and visual of the app. I wanted to highlight here some resources that both Brightlife Kids and Soluna have ready and available for you today. So that is both our digital toolkits, which have social assets. So ready to go, made Instagram posts, Facebook posts, digital assets that you can post to your socials to get the word out there about these free resources. We have instructions on how to add Soluna and Brightlife Kids as resources to your websites, as well as email templates for how to get the word out to your communities, to your parents, etc. And then we also have printed materials as needed that we can ship out to you. So that is everything from flyers, posters, postcards, or QR cards. To dive one level deeper here, we have some additional ways we can put those resources into practice and partner. So, for example, one way in which we can support in getting the word out is through these sort of turnkey resources. So again, distributing our resources to family, to staff and community, getting onto your resource page on your website, as well as I noticed a bunch of you have offer newsletters as well, promoting Soluna through your socials. Those are practical ways you can utilize the things that are ready today. We also have ways in which we engage much more closely with your communities. We have customer success managers on the ground all throughout the state that are local to all of you. And their primary goal sorry, I just blanked on the word for job. Their primary goal and and job responsibility is truly to be out there in community with all of you, and to spread the word about Soluna and Brightlife Kids. So anything from presentations directly to youth, to your families and youth, to staff demonstrations and trainings, on-site tabling at events that you're hosting. We are here to support and be as low lift and high impact as possible for you all. We know you're busy people, so we're really here to support in getting the word out so that you don't have to. We found that the most effective way to do that, as you can imagine, is being a real person in front of real people. Those youth-facing presentations in particular tend to be a huge hit and very successful for us. More sort of formal referrals aren't required, but are always an option. So again, like listing us in your resource binders, finding us on in Find Help, which is our searchable repository, and then request printed materials for your referral coordinators or case managers is always something that we can provide as well. Okay, I think that covered everything. I will end on this slide here with our contact information as well as QR codes. And I will drop our Soluna phone number here. Thank you, Noah, for grabbing that for me. I couldn't remember it off the top of my head. Awesome. I'm seeing some questions here for youth presentations. Would it be appropriate to have youth ages 10 to 17 present? If so, we'd love to have one for our youth. Absolutely. Yeah. We do youth presentations for Soluna 13 to 25. For Brightlife Kids, I think they also could offer some youth presentations. But either way, what we would probably do if it was 10 to 17 is I'd probably do a little Brightlife Kids overview for those 10 to 13 folks, and then would do some Soluna overview for the 13 to 17 folks.
Yes, and basically, just to reiterate what Sophie said, we do presentations both to other partners and directly to parents or caregivers. So feel free to email us and let us know what your preference is and what you're looking for. And also our Brightlife Kids team, 50% of our CELs are bilingual in English, Spanish. So if you need presentations in Spanish as well, let us know. And we'll also open it up to the floor. I see one question from Stacy about community resource events. I think I speak for both of us when I say we're everywhere and anywhere. We've been to health fairs, open houses, parent presentations, conferences, large city events. So our community engagement teams are really here for you. And if you think there's a space that makes sense for us to show up to, we would love to do that in partnership. So feel free to email us any ideas that you have. We come with tablecloths and swag, and it's a good time. So would love to see you all in person.
Awesome. I'm just checking the chat and also trying to find my list of the 19 Medi-Cal languages, if any of you have them on hand.
Oh yeah, I can grab that for you.
Thank you. Yes, Melissa, I see your question here. We do have resources for them as well included in the app. Some are content specific. Some of our coaches are trained specifically as well. And depending on, we also have different features within the app itself, depending on the disability. So if hearing impaired, if vision impaired, etc.
And I'll just say same for Brightlife Kids. We do have coaches who specialize in differently abled children. There's a question also about Native counselors who are culturally competent. Albert, off the top of my head, I don't know every single coach and counselor at Bright Life Kids, but I can definitely take a look into it and see if there's anyone on the team.
Yeah, and I know for similarly, I don't know all the coaches off the top of my head, but I do know that within the app, users can select different sort of either different topics or categories that they'd like to focus on when they're scheduling their time with a coach. So whether that be anxiety, depression, you know, identity factors like LGBTQ plus, right? They can select these different categories, and then it'll show them a list of coaches that either identify with those categories themselves or have you know, a specialized background in those categories. So that could be something that the user could select as a sort of filter for coaches.
Claire's question on how long a presentation can last. We're really good at fitting into your time slots. So it can be anything from 15 minutes to, like, for example, today we have more time for Q&A. So it's a little bit closer to an hour, 50 minutes. We like to keep, for us at least, parent presentations a little bit shorter because of, well, parents are stressed. Right, and their attention span. So we really do what works for you, and I think Kuth is the same.
Yeah, definitely. Stacey, to my knowledge, complex trauma is not an exact category within coaching. It would probably be something more specific. My other guess is complex trauma falls to me at least closer under the category of clinical, like higher acuity level of care, clinical support. So it might be something that's surfaced in a conversation with a coach, and then the coach would work with that user and with care navigation. Should that user have a higher level or a acuity need to reference that user out. So yeah, to my knowledge, that isn't a specific category. There might be elements that within that more specifically that are categories that a user could select. Hope that answers your question. Great question, Thurman.
And if we missed anything, I'm scouring the chat, but if we missed anything, feel free to unmute yourselves. I think we addressed all of it, Sophie.
Definitely. Yeah, we have done mental health assemblies at schools. We're here in California as well as Pennsylvania, and Pennsylvania is recently doing what they call COOTH days. And it's exactly that. It's where they go into schools and they go into all school assemblies and they present on Soluna. And the efficacy of those days has proven to be very, very high. As you can imagine, like the more youth that we can speak to at once, the better. So yeah, if we've had great success with it, and if you know of a school that may be open to having us come and talk about Soluna or Bright Life Kids at an assembly, you know our email, you know where to find us. We'll be there.
Got a question.
Yeah.
How far will you travel, and is there any cost involved?
We will travel anywhere within the state of California, and there is no cost involved.
And the age range is from what to what?
For Bright Life Kids and Soluna, it's 0 to 25. For Bright Life Kids, it's 0 to 12 and their caregivers.
All right. By the way, this is Frank Kelly. Excuse me. All right.
Hi, Frank.
I am now in Victorville, California. Okay.
Yeah, and I'll just add for the school assemblies, I think just the caveat to remember about Bright Life Kids is because of the age range that we deal with, we always will need parent and caregiver consent for the family to be involved in our program. So anytime we engage with schools, we're also making sure that the parents and caregivers are involved.
Good call out, Noah. Thank you.
What would that look like for a youth presentation? So we have an event coming up for our Brighter Futures for Children of Prisoners program, and it's our summer college camp where we'll have approximately 50 youth staying overnight at college, and we have a variety of presentations and activities. So the parents are not there, but they've given permission to come to the camp. So that's what I had in mind. Like, wow, it would be so great for someone from one of your teams to be able to share this with the kids. They can practice it, they can learn about it. Would we get parent permission in advance for that, above and beyond our regular permission forms, or what would that look like?
So for Soluna, there isn't a parent permission required. Part of that just has to do with California law, and our 13 and above youth in California are allowed to, engage with, download an app like Soluna independently without parental consent. So for Soluna, it would just be a matter of us communicating around dates, times, when, where, place, all that good stuff. And that's really it. But I'll let Noah speak to the Brightlife Kids element.
Yeah, Claire, I think it would be helpful for us maybe to meet one-on-one or chat one-on-one to kind of figure out the scenario. But yes, high level, it is the parent or caregiver that generates an account in our case. And we will need their consent regardless. So if that's before, the event happens. So we can talk about kind of what that would look like.
Great, thank you, appreciate it.
Also, the last thing I'll plug as well is if there are, if you're excited about this, which I hope you are, and you want to have further conversations around partnership, in particular, I'll speak first, Soluna, we're really focused in back to school and summer engagement right now. We know that summer is a challenging time for youth when they don't have their in-school supports. So we're really trying to get in front of youth as much as possible. And trying to get in front of them as back to school starts as well, as they get back into those classrooms, so they know that they have this resource available to them moving into the school year. So if you are thinking about opportunities that you can already see in your mind for us to come and chat with your families, chat with your youth about this, and you want to have a one-on-one conversation, please email me and we can set that up, and I can connect you directly to the customer success manager that is most local to you. They'll host that conversation and can get those things in the books and talk about all of the extra fun ways in which we can support y'all in partnership. And I'm sure that goes the same for Brightlife Kids. If you want to engage further in partnership and have that one-on-one conversation, Noah is your gal. And can set y'all up that way.
Yeah, absolutely. Encourage everyone on the call to reach out to us, and we can sort of generate a partnership that's right for you. So we're really here to be flexible and work with you all who are the experts in your communities and do, what's best for the families that you work with. Any other questions? All right, there, Palvinder, I think, and yeah, yes, there were a couple questions just about follow-up. So I don't want to overpromise anything, but just want to say from our end, we're happy to share the deck, all of our links, and provide all the resources. So just want to say that we're happy to enable that and make sure we can all stay in contact.
Yeah, thanks so much, Noah and Sophie. We'll go ahead and send out the recording along with the slide deck, and also share the contact information from both of the teams via an email. I anticipate the center is actually closed for our wellness initiative on Friday afternoon. So we'll likely get that email out next week. And so just be on the lookout for that with additional information. As Noah mentioned, that they'll share their contact information, so you'll have a direct way to get in touch with them. And if in case you missed that email or can't find it, you can go ahead and reach out to us, and we'll also directly look to put you in touch too, or reshare that contact info.
Awesome. Thank you guys for having us. Really appreciate it.
Yeah, of course. Thank you so much, everyone, for joining and staying on, and we'll share those resources next week. Have a great rest of your week and weekend.
Thanks, everyone.